Hi, good evening. Austin Mayor Steve Adler. Got a minute. We're going to go over the COVID numbers so that we can see those. We're going to talk a little bit more about the governor and his order opening up the economy and doing away with the masking mandate. A little about the city council meeting tomorrow. Not going to be too long tonight. Let's begin with the COVID numbers as we do. And talk about where we are. Let's begin with the key indicators that we use for staging. This is the chart. It shows you, as you can see, that the number of new admissions is 32. That's up yesterday. Yesterday it was 30. But even though it's gone up from 30 to 32 yesterday to today, the 7-day moving average went down from 29 to 28. That moves us a little bit deeper into the yellow area. So forgetting what the governor's done, Dr. Escott is still focused on trying to preserve the keeping open of businesses and the further opening of schools. So he is the science that we indicated we would follow here. So his advice to us in the community, he wants to make sure we can hold on to the gains that we've achieved in this yellow area. I'll tell you the governor's move today. Yesterday has added some uncertainty associated with that. We have another variant that's coming in. University of Texas, based on their studies, indicate about a third of the people they're testing right now have the UK variant. We'll have to see if that has the same effect as it had in the UK of accelerating the number of cases and the seriousness of cases. That number stayed pretty constant from week to week, last week to this week at the University of Texas, which is not what people expected. So we have some uncertainty there we're going to continue to watch. Of course, the governor on effective March 10th is letting bars operate in our city with people not wearing masks. Seems pretty crazy to me, but that adds an uncertainty with respect to numbers and behavior. We're concerned about all the people in congregate settings during this winter storm and power outage. What happens when we had so many people so close together? I understand that a whole group of volunteers that were working one of the water places, as it turns out, now are showing up as infected with the virus. So we just don't know. But in any event, 28 is better than 45, is better than 70, which is where we have been before. So that's good to see. The positivity rate at 6.9%, as we talked about yesterday, is a good sign. New cases at 186 over on the right-hand side here is below the 7-day average, and that is a good sign for us. Cautious. Those are good numbers. Let's see if we can hold on to them. Let's see if we can push them down even further. Of course, that's going to require us to be wearing masks just as religiously as we have been, regardless of what the governor's order says. He says no mandate. He says you still have a choice. Thank goodness we have that choice here in our community. We can choose to best protect our community, and that is what we need to do. Let's take a look at the hospitalization numbers and the ICU numbers and the ventilator numbers and compare them to the 7-day moving average so we can see how we're doing with those. We pull up the second one of the dashboards that you see here. You can see that the number of folks in the hospital census tonight is 242. The 7-day moving average is 264, so we're below the 7-day moving average. ICU units, intensive care units, we're at 74. The 7-day moving average is 84. That's a good sign. Ventilators, folks on ventilators, 53. 7-day moving average is 60. So those numbers are all moving in the right direction. And a lot of that's because we've been focusing the vaccines on the older folks in the population. Those are the folks more likely to show up in hospitals, to get on in ICUs and get on ventilators, but not exclusively. More and more, we're going to see younger folks, 40 to 59, 20 to 40. Will be a greater percentage of these until they start getting vaccinated as well. Over 76,000 cases here in Travis County. Number of deaths, 754. That's up 5 from yesterday, which was up 5 from the day before. 10 people passed away over the last 2 days. 5 people passed away in the last 24 hours. Still a deadly disease. Boy, everybody, hold on, mask, distance, at least for another couple months until you can get vaccinated and save yourself from this. You don't want to be among the last person to be killed in a war. You don't want to be among the last to die from a pandemic. So those are the numbers here today as we went through them. Let me talk for a little bit about vaccines. Today, Texas implemented the directive coming from the federal government, added a new category of folks that are eligible for vaccines. Today, most school workers, school staffs are now eligible, whether you're older or younger than 65. Child care workers in Texas now eligible for a vaccine, even if you're not 65. So the policy issues that folks weigh when they're trying to figure out who it is that gets the vaccine, you want to get it on the one hand to the folks that are most vulnerable, and if they get the virus, most likely to pass away. You also want to get it to the folks that serves as vectors, folks that are most likely to run into the most number of people. So if they get it, the greatest spread of the virus would come from those folks. And there's debate, and different states are handling that differently around the country. But in Texas's case, we've been focusing on those that are most vulnerable, older folks, those with comorbidities, healthcare workers, frontline, and but now focusing also eligible school workers and childcare workers. In this period of time, the governor changed the orders yesterday, opened up businesses 100%. The thinking right now is that we don't have the ability by local orders to overturn what the governor has said. We're going to take a look at the numbers. We may challenge that as we started to in New Year's Eve, when we really urged people to pull back on that day and entered an order to do that. Dr. Escott also has the ability to enter orders. So we're going to take a look at that, see what happens to the numbers. Hopefully there doesn't have to be a legal confrontation there. That's certainly a possibility. But for right now, we're going to rely on the community to make the right choices. This was never about being able to enforce our way to compliance. It was always about the choices that we make, both for ourselves and for people around us. So we continue to urge people, use the choice that the governor has left to you, and choose to wear a mask, and please do it religiously. Businesses, please choose to enforce it among your customers, protect your workers and those that do business with you. Scientific studies still virtually unanimously demonstrate that wearing a mask is effective. In fact, it's the most effective thing that we can do short of a vaccine to stop the transfer of the virus. I know there are arguments otherwise on social media. There's just not the scientific backup to those claims. We should all be wearing masks. Remember, Austin was one of the first cities to implement its own citywide masking mandate. We've had a pretty strong push for that, and the community, which is a pretty early complete adopter. That's one of the reasons why Austin has one of the lowest mortality rates. In fact, it has the lowest mortality rate of any big Texas city, and one of the lowest mortality rates among big cities in the country. Because so many people so early adopted that. We had a mandate. The governor took away our ability to do it. We kept fighting to get it back. The numbers started spiking again. The governor gave us the ability to do it again, which we did. And then later, I think based on the fact that it was working so well now in other cities as well, in addition to Austin, the governor copied that and then implemented that statewide, and we were all thankful that he did that. When the governor started, he said that he would be guided by the science and the data. And he promised us that. And I will tell you that I feel that the action yesterday to take away the masking mandate, he broke that promise. Because the science and the data, everyone in research field was advising him to keep that mask mandate on. It is the best way to better ensure that we're going to be able to open up schools to all kids to in-person learning, the best chance we have of further opening up businesses without the threat that they'd have to pull back. And frankly, I'll wear a mask in order to drive those two priorities. It's just not that big a deal to put at risk those two priorities. I think most of the people in our community feel the same way. And I'm hoping that means that people and businesses in our city are going to continue to do that. Masking keeps frontline workers, restaurants and bartenders safe, while it also protects the public. It also gives people that go into businesses to retail or other places a greater sense of confidence that they're going to be safe. And I would think that would be good for business because that's where people are going to want to go to be able to shop. There is no scientific basis to support what the governor did yesterday. And my concern is that it creates an ambiguity, a messaging ambiguity. And some people will see what the governor did and think it means that something other than that masks work, and they do. But they'll hear what the governor did to call that into question. It's something that is necessary and effective. I'm concerned that the governor's action yesterday will cause some people to think that the message now is a little bit ambiguous, or that it might create the impression that we have solved this and we're past the virus now. And that is not the case. Only about 10 to 15% of Texans have gotten even one shot. Only about 5-6% of Texans have gotten both shots of the virus. We have a long way to go before there's anything like herd immunity, like 80%, some people say. So for a while, people should be wearing masks. Even if you've gotten the vaccine, you should wear a mask because you don't know whether you're carrying the virus. You don't know whether you could infect other people at this point, even if you're not going to get dangerous symptoms. So we have to continue doing that. Bottom line, our community has a choice. We have the ability to control this for us. Just because the governor says you don't have to wear a mask doesn't mean that you can't. You can make the choice to wear a mask. You should make the choice to wear a mask, both to keep you and your family and other people in their families safe, just like we've done over the last 2 weeks. The last 2 weeks, we've had people coming out everywhere to help their neighbors and their family, to help strangers, the other residents in our community. We pulled together, and this now is one of those times. We have to wear masks. I am especially concerned and nervous for the essential workers under 65 who are not even eligible to get a vaccine now. They're not eligible to protect themselves, but yet they could be frontline workers in a retail store having to deal with a customer who's not wearing a mask. That's not fair, and it's not right. And somebody who's not wearing a mask that puts that essential worker at risk that way is I think doing something wrong. It's selfish, and to put somebody who can't defend themselves at risk because you don't want to wear a mask. It's not that onerous a thing to do in order to protect other people. The governor can break his promise to us about following the science and the data. And all that means is we have to make a new promise to each other to do everything we can to keep them and their families as safe as we can. I'm already seeing a lot of businesses in our community announcing that they're going to continue the current practices to keep patrons and employees safe, make sure their workers are all wearing masks, making sure the people coming into their establishments are wearing masks. And I want you to know how much I appreciate folks that are doing that. If you email me or tweet me that you're doing that, I'll give you some recognition because this community should be saying thank you for doing that. I urge everybody to mask up and use the hashtag, if you will, hashtag #MaskUpATX. Because that's our focus right now. I appreciate that the Chamber of Commerce in the city has taken the position that businesses should still maintain current masking policies. And I appreciate the Chamber urging the business community to do that as well. We continue on with the recovery of the power outage and the water outage. Today, the council committees for Austin Energy and Austin Water met, heard from staff just beginning the process to debrief after the storm. We're trying to understand what happened and make improvements both to the systems and our response so that our city is more resilient for future storms, so we can learn and do better in the future, but also recognize the things that we continue to do well, giving millions of bottled water out and continuing to give out hot meals to people, assisting people with support to be able to do plumbing repairs, whatever people need. I urge you, go to austintexas.gov/weatherinfo, austintexas.gov/weatherinfo for further information about water and food and supplies that are being distributed and help with cleanup. The council meets in its regular meeting tomorrow at 10 a.m. I think something of interest, the council is going to consider a resolution from the mayor pro tem, Harper Madison, was one of the co-sponsors of it, requesting a study of the city's historical role in racial discrimination and segregation. Going back to and before perhaps the time in 1928 when our city adopted a land plan, the white community deciding it wanted the land that the folks of color were owning around the city, and adopted a new plan that forced them all to leave their properties and go to a part of the city that was designated for them, adopted a policy that denied those folks utility service if they didn't move to where they were supposed to be under that plan. In the 1950s, the city council here in Austin doubled down and reinforced and reiterated be able to exploitation of people in order to build wealth in the white community. The reason that there's such disparity of wealth in our city, the reason that there is a 10-year differential in life expectancy if you live on the east side of town or the west side of town, has its roots in long historical policies that, quite frankly, now the white community is taking advantage of to the detriment of the communities of color, especially the Black communities in our city. So this is a resolution that asks us to actually take measure of that, to really recognize what it was that has happened, for the city to recognize its role in that racist kind of behavior, segregation, discrimination, to formally apologize for the actions that have been taken in the past in our name, and also then to support policy action and funding for racial reconciliation at the federal and at the state and at the local level. I think tomorrow's going to be a pretty historic day for the city of Austin in this regard. Also for Austin's African American community, it's one that is long overdue. And while this resolution is the beginning of the process to make these communities whole, providing African American Austinites access to the same level of opportunity as their white counterparts, it is an important and vital step. All we have to do as we have over the past year, is look at the impact that this pandemic has, the disproportionate impact that it has on communities, African American and Latino communities. All we have to do is look at the disparities associated with this winter storm we just went through. People's abilities to be able to stay home, still have their jobs, make money, telecommuting. Those folks are disproportionately white, folks that have to go to work, working construction sites, essential workers, stocking shelves, disproportionately folks of color. Tomorrow's resolution creates and starts moving us toward, it creates the opportunities, moving us toward resources that are needed to increase business and educational opportunities so as to increase the underlying equity that we have in the city. I want to thank the Black Austin Coalition and the Mayor Pro Tem and just all the others who have worked on this resolution. I look forward to being able to vote for it tomorrow. And because tomorrow is a council meeting, we're not going to do Got a Minute, but whenever the council meeting ends, could be late, if not whenever, soon after the end of the meeting, I'll go on Instagram and just give a quick recap of the meeting. With that, you all take care, be safe, and good night.